friends, if you have been prescribed G-CSF and you want to know the when, where, how and why of this medicine, this is the video for you. I am Dr. Swati Kanakia, Pediatric Hematologist-Oncologist from Mumbai. So let us start with the first question. What is G-CSF? As the name suggests, it is the Granulocyte Colony-Stimulating Factor, and therefore it stimulates the bone marrow to produce neutrophils. What are neutrophils? These are our first line of defense against bacteria, and therefore they behave pretty much like our border security force. So if you don't have neutrophils, or if the neutrophils are less, in that case you stand at an increased risk of severe infections or sepsis. Where is G-CSF used? It is used in those conditions in which there is neutropenia and there is a risk of overwhelming sepsis. This happens commonly in children and in patients who are on chemotherapy, in whom the neutrophil count is very low at times. It can also be used in patients who have a low neutrophil count due to congenital reasons, means since birth, for example, Castman syndrome. It is also used for patients, people who are donating their bone marrow before a bone marrow transplant for somebody, because it is seen that G-CSF also increases the mobilization of stem cells, which are the main cells which are used for a bone marrow transplant. How is G-CSF given? So it can be given IV or intravenous, or it can also be given subcutaneously. Subcutaneous is the most preferred route. Frequently G-CSF can be given at home. Parents can also learn how to give it, or you can have a local doctor who can give the G-CSF subcutaneously. The commonest question is it safe for my child? Well, it's a very safe medicine. Once in a while, children would get bone pains and body ache because the bone marrow is producing so many more cells. There could be local irritation or a little bit of redness at the site of the injection. Beyond this, there are only rarer side effects which your doctor will definitely guide you through. How long is it given? Well, we give it until recovery of counts, and it just depends. So anything from 3 days to maybe 5-6 days. There's also another form of G-CSF which is available. This is called as the pegylated G-CSF, and this acts for a very long time. So the number of injections that you need to give are way lesser. I really want to finish off this talk with a very interesting fact. This is a medicine which has taken more than a quarter of a century to get developed by a very dedicated team of doctors and scientists, and it has saved millions of lives, and it will continue to do so. Thank you friends for watching this video. I hope it was useful. Please remember, this is only an educational initiative. We are trying to empower parents to make the right choices and to give them some knowledge about very complex diseases. Please follow all these videos under the guidance of your doctor and your hospital. For more such videos, please follow us on YouTube. Thank you so much.